Hello. Good morning, and welcome. We are about to start our event today, which is What Comes Next, Biomedical Science. And this has been organized for you guys by our amazing alumni relations team and also our employability director, Dr. David Gaze. So David has put his camera on here so you can see David, which is wonderful. And I am one of your co-course leaders, Lorna Tinworth. So you guys all know me, don't you? So that's fine. And I'm going to be your panel chair today, but David and I will tag team it, so you won't have to listen to my voice too much. So I am joined today by a panel of recent biomedical science graduates, three awesome individuals. Tino, who I worked with a few years ago on a co-creators project. Joel, who suffered as he was one of my project students, and also Ina. And Ina has recently come back to Westminster and also worked with some of our level 4 students to inspire them. So we welcome them today. So the panel in a moment are going to introduce themselves, and then we will put some questions to them. And then you will have the opportunity to put your questions to them. Before we start, we're going to do a little bit of housekeeping. So this session is being recorded. Somewhere on your screens, you will see a notification that that is the case. And we will share the recording with you at a future date. But just reassured, we will not put any students in the recording. So you don't need to be concerned that you're going to be in the recording here if you're just watching. Your cameras and your microphones have been turned off, but you can see that the chat is on. So feel free to type in the chat, say hi to each other. So yeah, I can see some good mornings in there. Tamara and Abba, and let me see Mark and Sarah. Good morning. Okay, so in a minute, as I said, I'm going to ask the panel members to introduce themselves and we will ask them a series of questions and there will be time. So whilst you're listening to their answers, have a think about the questions that you want to ask them. What is it you want to know about their journey that will inspire and inform you? And any time during the presentations, you can put those questions in the chat. But what we will do is we will collate those questions and then at the end, we will put them to the panelists because probably some of you have similar questions. So whilst we're listening, there will be a team who will collate the questions and then we will bring them all back to you at the end. When this event is over, you will be asked to complete a feedback form. This feedback form is super important. It really helps us to know what worked for you, what didn't work for you, what you want more of, and so that we can plan future events. So when that feedback form comes to you, please fill that in. There is a little reward. You might win a £20 Amazon gift voucher if you fill that in for us. And there will be the link to that will go into the chat. So you'll be able to see that at the end. All right. So any questions about that, please pop them in the chat. I will keep an eye on it. Let me see. So William has a question. Can we ask theory questions for on the module? So William, I would rather we didn't do any discussion about the content of your biomedical science course because we are here today to listen to these panelists about their career journey. But William, if you have questions for me, you can come find me. I can talk to you and we can talk about the course content at another time. Is that all right? Okay, good. So let's have a look here. So today I've introduced them slightly. So like you are now, not long ago, these panel members were finishing up their degree. And so they understand your experience and it wasn't that long ago. And since then, they've gone on to do quite an interesting range of careers. We've got three of them here. So Ina, Joel and Tino. And I'm going to ask the alumni in order with Ina first and then Joel and then Tina Tanda to introduce themselves and then briefly tell us when they studied, what they studied. Okay, they all did biomedical science, but there are option modules, so what they studied if they remember, and then a little bit about their career so far. Is that okay with you guys? All good. So we're going to go Ina first.
Hello, guys. Good morning. Hi. I'm Ina. I'm a biomedical scientist in immunology now, and I was 2 years ago. I was literally you guys, third year biomedical science students, but my journey in university started in 2019. I enrolled in biomedical science with sandwich year, and I got to experience firsthand all the chaos with the COVID-19 and having to adjust to online learning and all that stuff, which was really interesting. And I think it was a character development experience, to be honest. I think for all of us. Um, on my third year of university, I did my placement at HCA Labs, where I completed my IBMS portfolio, um, and which then provided me the HCPC registration when I graduated. When I graduated, the same lab offered me permanent employment, and that's where I'm working now. I graduated in 2023, and here I am at the present doing my specialist portfolio in immunology. Yeah.
That is lovely. Thank you, Ina. So quite inspiring. Lots of you experienced that COVID thing. So awesome that you did so well. Even out of that, it all gave us things to challenges, and then things that it brought out strengths in some people, didn't it? It's awesome. Okay, lovely. Okay, Joel.
Can you guys hear me? Okay. Perfect. Yeah, so I'm Joel. Lorna, as you said, I was one of your project students. So during COVID, actually, we were in the middle of our project when COVID hit. So again, I started in 2017, was there 3 years doing my undergrad, then COVID hit and threw the world into the unknown. I also did a master's at Westminster as well the year after. And then after that, I came across, it was a COVID job actually, just basically doing admin for Moorfields, eye hospital based at City Road in London. Not actually too far. We do have a Moorfields on New Cavendish Street now as well, funnily enough. But so yeah, I did that. And then as time went on, I moved a bit more towards the science aspect, eventually becoming in charge of point of care testing in the entire hospital, which was great fun. And then as time went on and eventual reorganizations in the department, I got another opportunity to become a tissue center technician, which is effectively all of Moorfields' life sciences being put together, and I work across. I still do point of care. I'm still basically in charge of point of care, but I'm also working with donor eyes. I'm literally sat next to a load of donor corneas at the moment. And then I'm also working in the histology lab as well. So we are one of, I think, 3 laboratories in the country that do ophthalmic histology. So working there, plodding through my portfolio while I'm at it. And yeah, basically just being a spare part for most of the life sciences of Moorfields, and also trying to develop myself while doing that as well.
Awesome, Joel. Thank you. It's quite a journey, isn't it? But awesome.
Yeah.
Okay, it's lovely to see you. And Tino.
Hi everyone. Hi Dr. Lorna. I'm Tina Rodzi. So I was trying to think about my years when COVID hit for me, and I think it was middle of my second year, which wasn't great. Like I was getting into the swing of things, and then COVID hit and went through that whole process, finished second year online, came back for the last bit. I graduated from Westminster in 2022 with my undergrad, and then I went straight into industry. So I now work as a project manager for Pathos Therapeutics, which when I joined was a smaller stage biotech company, but we've now progressed quite rapidly, which tends to happen in the sector. We're now a clinical stage oncology company, and in project management, because we're a small team, I'm really lucky that I get to work all areas of the business. So most of my time is now across operations. So that's business development, investor relations, part of the legal team and contract negotiation. But I also support clinical supply chain and CMC, so developing the drug product that goes to our patients as well. So yeah, it's been a great journey for me, I think, taking what I learned in biomed, but opposite to Joel, I guess, moving further away from the science, but I'm still involved. And the background knowledge has been great. But for me, it's, I like to have a flexible role and a mix and match of things. So yeah, I've been really enjoying it. And that's where I've been since I left university.
Thank you, Tino. Thank you, all three of you. So hopefully that's quite an inspirational beginning to what our participants are going to share with you today. So David is going to ask the next question, I think.
Okay, thank you, Lorna, and great to see you guys. It's fantastic to hear your journeys, and it's nice to see those familiar faces on the screen, which is fantastic. So what we've got here is a couple of questions for you from myself and Lorna. As Lorna said, we're going to have a tag team. So between us, we're going to ask you some questions, which hopefully will give students that are on the call some inspiration, and will allow them to think of some of the questions they want to ask further on. So the first question is, what did you do at Westminster that helped you figure out your career path? Did you have an interest in a particular career path at the beginning? And then also, what maybe on reflection would you do differently if you had your time again with us? Would you do anything differently to what you experienced? So maybe if I start with Ina.
So for me, I think I already like when I enrolled, I kind of knew that it would be daunting for me to go into the workforce without any experience. So I really opted for the 4 years, which included the the placement, and that for me has been literally changed the course of my life, because I'm employed where I did my placement now. But yeah, if I did anything that was different, I'd probably kind of look outside of just biomedical science, because with the placement I was a bit linear of thinking I'm going to be doing diagnostics, I'm going to be a biomedical scientist and specialize in a discipline. But now there's so many different applications of biomedical science. There's I have a friend we graduated the same year, and she's doing data analysis and working from home for NHS. So with the same degree as I am now. And I also know someone who's doing something in finance. So I think I was a bit more kind of linear and focus on one thing. And if I was to do it again, I'd probably do more research on other things that I can apply my knowledge in biomedical science in. Yeah.
Okay, thank you. And Joel.
So what I would do differently. So you guys have option modules, right? What I would do is I would consider the option modules a lot more. Like they can like influence what you do in the future as well. So I'm sure everyone else knows, but digital medicine is up and coming so quickly, and it's getting faster and faster and faster, and it's becoming a more and more important part in our society. So even little things like, so here we have cataract patients that are now being seen completely online and just coming in day of surgery. I've just been emailed about this metagenomics project that bioinformaticians are going to be working on in our hospital. And then in our lab as well, we're moving to pathologists reporting cases remotely and then being able to get second opinions from all around the world because of digital pathology. So I would definitely recommend looking more at the digital aspect of stuff as well. Also, I know there will always be some lectures on research, and people are always find these boring because it's just like statistics and stuff, but pay attention in them. They really do come in useful, especially when doing audits, especially when you get the opportunity to become involved in research and you're presented with loads of data that you need to work through. All these statistical tests and everything, they all start making sense as well. So pay a lot more attention in research related courses, and also consider digital and the movement of pathology towards digital when also selecting your future path.
Great, thank you, Joel. And I think we can all nod around the table here, and completely agree that digital and AI is going to be a massive, massive influence in biomedical science and life science in the future. So yeah, good on touching on that. And Fatino, what with you? Did you? I think maybe because your career path is slightly different to that classical linear into the hospital laboratory. Did you have that? Did you have that concept of wanting to work within industry straight away, or did that become more apparent to you as you were doing your degree?
Yeah, I think it's interesting actually, because similar to Ina and Joel, I think I was quite linear with my thinking, and it's probably because you're in an environment where you're most exposed to biomedical science roles or scientific roles. I originally wanted to do genetic counselling, and that was linked to my optional modules in genetics. I found it incredibly interesting, and I got to work with Dr. Lorna as well on a co-creators project around genetics and racial injustice and things like that. So for me, I was mixing together, okay, I really enjoy genetics. Sociology and social justice is really important. I know I prefer the people side to being on the lab bench. So that's kind of why I went down the genetic counsellor route. And I think a lot of my experience that I did later on for third year was based around that. And I actually got rejected from the role because you need a lot more experience and usually a master's to get into it. So you kind of go into that panic mode of, okay, what do I do next? I want to be really flexible, but I don't think I've given it as much thought as I should have. And so I kind of stumbled across biotech as a sector in general. I think at uni, you don't really get much exposure to it. It's quite a fast-paced environment. The teams are usually very small, for good reason, because you're trying to move quickly with limited investment and things like that. So where I found the opportunity, I did a lot more research and YouTube videos and things like that, and found, okay, this does suit my personality and what I enjoy, and the fact that it's based in science and helping people, but potentially there's more of a commercial element to it. So I would just say I would do more research on it for you guys earlier on. Have a look at the biotech space, pharma as well. It's very different between the two. If you're someone that likes to be flexible and do a couple of jobs that maybe aren't necessarily on your CV when you first join, then I would definitely go down that route. But pharma can also be a great opportunity if you know exactly what kind of indication or disease area that you want to work with, or you want to be a bit more strategic with that approach. But yeah, I agree that I think expanding your horizons earlier on, speaking to the people around you, even though it doesn't sound like a role that you think would fit with your degree. I think Ina said it as well. Biomed is incredibly diverse, and there's a lot of recruiters who will take you for finance or audit or AI and tech as well, because of the analytical skills that you've developed from this degree, even though it's not directly related. So yeah.
Brilliant. Thank you. I'll hand over to Lorna. Oh, you're on mute, Lorna. Sorry.
Thank you. Sorry. I just wanted to say I'm loving hearing these answers, because there's so much richness in what you're saying just between the three of you. You imagine our alumni go out and they're so diverse and so different. It's awesome. Okay. So again, the same order. So Ina, then Joel, then Tino. I've got a question for you. So what specific skills did your degree course give you that you have found the most valuable in securing and performing your current role? So Ina first.
I think I'll be generic, but it's really real. Research skills has helped me in so many different aspects of my life, like just knowing what is what's a fact and what is just like a hearsay. Like there's a lot of information online that says a study says or a research says, but people just believe it straight away. But having that skill to look for the facts, like who did the study and is it real, what kind of experiment did they do, how did they prove it, that kind of skill that I got from my degree was really helpful. Even like looking for jobs, for example, like there's a lot of like scammy jobs now coming up in like LinkedIn and all that stuff. That just skill to look for if it's real or not, if it's authentic, I think that has really helped me throughout my life, and I'm still using it now in all aspects as well. And I'm currently doing my biomedical science specialist portfolio, and although it's quite bizarre, they don't really specifically ask for references, and I still do referencing and do my research skills and kind of apply that. It's just kind of ingrained in me now. But yeah, definitely research skills.
Lovely. Thank you, Ina. And Joel.
It's an interesting one, but I think the best skill I've got is actually application. It's very easy to just have information thrown at you in a lecture, but I think what's really important is that I remember when we were taught, we were always taught how to apply stuff, not just to know that cardiac troponin means you've had a heart attack. It means knowing that what levels mean what, and I think that's really important. At Moorfields anyway, because we don't have an on-site blood lab, we only do histology, and I do a lot of blood samples. I get a case where even consultants sometimes come and be like, oh, what does this blood result mean? But because of what I've learned at university and my ability to apply something, it's really helped me. There's even one case, I remember this module like it was yesterday. It's I don't know if you guys saw the applied pathobiology in year 2. Yeah, there was this case where we learned that a patient has schistosomiasis or something like that, and literally you could make it up. Like 2 weeks ago, a patient seems to have walked in with schistosomiasis into an eye hospital, and leading applicating like applying all your knowledge to work this out, I think is what's really important. It's not so, like, don't worry if you don't remember all the information. No one's going to remember everything that's thrown at you in a lecture, and I think that's really important. What matters is that you know how to apply it, and you know where to find information, and you know how to understand it, which is what I think is really important. And I think that's what I found the most rewarding.
Thank you, Joel. And Tino.
Those are such good answers. I was thinking of not copying what they've already said. I think it's a mixture of what's already been mentioned. because biomed was so broad and the industry I'm in, especially in Pathos, we go from preclinical to clinical. Having a basic understanding across all of my modules has been really helpful. I think, I'm working on toxicology studies in vivo as well as clinical applications for phase 1 studies. And I have to be able to summarize that information and report it back to executives. Working with the scientists and understanding what they're talking about and being able to summarize a large amount of data and reports and information into slide decks and then translate that to varying audiences. I definitely developed that skill from my university degree, particularly the presentations that you do towards the end of your final project. I think people underestimate how important presentation is in any role, whether it's biotech or in lab research or anything else. Being able to take the ideas or the data that you found and summarize it and then explain the concepts and the story well is an incredibly important, what they call soft skill, but I think it will carry you really far. I mean, even in interview stage, being able to summarize yourself and your skills is really important. So yeah, I think that was the biggest learning for me.
Thank you very much, all three of you. All right, so back to David.
Thank you, Lorna. Okay, so I think what's really interesting is how you change your mindset as you go from starting your degree to the end of your degree and then out into the wide world after graduation. So what were the worries and the sort of concerns that you had as you were doing your degree in terms of employability and employment? And then how did that experience and those worries, how did that actually differ to what reality was when you actually graduated? So, how did you find that?
So actually, I remember not having a lot of worries. Ignorance was a bliss for me until my first rejection, and I was like, "Oh no, they don't want me." And that's when, like, I remember thinking it's probably because I don't have experience, or I'm even though I've got these technical skills that I've put on my CV from all my experiments in the lab, they want to see like if I've actually been in the lab, and that's why I started to like really having anxiety about it. But with the help of the employability services at uni, they were able to give me more confidence. I was guided really well through that. So if you guys don't know about that, please do check them out. They really helped me a lot securing my placement. But yeah, so I was worried about lacking of experience, but luckily I got my placement, which didn't really look for the experience because they know that they were getting students. So even then, I said that the placement helped me. I still had to apply to like 15 different applications, and I got rejected with all of them until like towards probably 2 or 3 months before we were finishing that kind of phase. Because in the second year of my second semester of second year university, that's where we had to apply for the internships, and I was towards the end of that semester that I finally got the offer. So it was after the first rejection, it was tedious. It was like 15 different rejections after I finally got my offer. So yeah, at first I didn't have any expectations, but the actual experience was really kind of tedious, and you really have to kind of practice the muscle. Like application skills is like a muscle that you're not going to get it the first time, and well, if you're really good, then good for you. But I didn't, and I had to kind of get like do applications and get checked, and then Hannah's like, no, that's bad, change it up. So I changed it again, and then kind of just really knowing how to sell yourself and the right side of yourself for certain applications, like tailoring it. But yeah, so that's my experience, just the reality of it. But so if you get rejections, don't worry, you will get it at some point. Just practice it.
Thanks, Ina. And it's great to big up the career service. We have an award-winning career service at Westminster, and I think one of the take-home messages from today is these guys are there for you. They know what they're doing. They are the experts. Use them. And also the fact you have access to them once you graduate for 3 years. You go out the door when you graduate, you still have access to the career service. Joel, what was your experience?
So, like you said, ignorance is a bliss. When I graduated, I really didn't quite know what I was walking into. so as I mentioned at the start, I graduated literally as the pandemic was just like taking effect, and no one quite knew what was going on. All hospitals around the country are basically hoovering up biomedical science students just to take them into testing laboratories to start running tests and everything. And so in all honesty, I think the best year to get a job in this field was definitely 2020, just because of how many people they needed. But I think it set in, for us, it was very weird. It set in a lot further down. So while we all know how the pandemic went, 2020, there was the rise and it dropped and then it rose again in the winter. And then come 2021, like is when they start realizing, okay, it's going to be an endemic in the population, can't realistically get rid of it, which is when they then started, okay, we're going to need to start getting rid of the extortionately high number of scientists that we seem to have employed. During this time is kind of when it sunk in for me. But thankfully, like as my hospital was going through it, this promotion to point of care actually came up. It's just when I kind of jumped ship into point of care, which was an amazing decision. But a lot of the skills I used in those interviews was stuff that was things that I'd learned in uni. Again, something that really stands out to me in uni. I don't know if you guys still do it in the project module. You have a mock interview. You guys still do that? That is really good, guys. Like go and use that as a really good opportunity. You learn what they might ask you and you learn how to answer questions. Because I'm assuming it's really similar in all laboratories anyway. When we interview people, we get given a rubric. We basically have to tick off what people are saying. Did they have the knowledge? Yes. Did they know how to apply? And that's really important. So practice your interviews. Don't just go into an interview blind. Practice, 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 and it really does reward you.
Thanks, Joel. And Tino, what was about your experience? Did you find that you had concerns before you started and moved into this graduate world in industry?
Yes, definitely. I think, again, opposite to what Joel was saying, for me, the job market was incredibly competitive for graduates. It was after the pandemic, particularly for pharma and for the larger roles that you get in London. Obviously, it's a London university, so I'm sure a lot of you are looking for roles in and around the city. There are thousands of applicants all going for the same job that you would like. And arguably, you all have the resources and the abilities to be able to get that role. But I think there's a lot of self-doubt that I felt about whether or not I was qualified enough. I hadn't done a year in industry or a full-on placement in my second year. And so you start to consider or pick apart your CV on whether or not you have enough in there to even get you to the interview stage. And what I would say is all of the work experience you've done, whether or not it's scientifically related, is incredibly important on your CV. And I would definitely recommend that you take youth of employability services to think about how you phrase it. Like, for example, I used to work in a nursery when I was doing my A levels, and I thought, oh, I won't say much about it, but there's endless skills that you learn there that are really important for how you portray yourself for a job role. So I think that was a really big one, a fear of not having enough qualifications, but it's also a graduate role. And I think it's also really important to remember that whatever role you're going into, they're going to be training you more. You're not supposed to know everything. It's about how quickly do you learn, how do you adapt, how flexible you are. And yes, you have analytical skills that you've developed from university, and you should be able to apply those, but it's not an exam. It's about understanding you as a person and how you might fit into the team that they're hiring for. And I think I've definitely learned that now being on the other side of interviews for graduates, even though it doesn't feel like I was there that long ago, and hearing kind of feedback that you get. If someone believes that you would have the capability to learn in the role and develop in the role, you have a much higher chance than if you feel like you have to have A's in all of your modules. Otherwise, you won't even have the opportunity. And just another thing I'd really stress is I was nervous about how I would present myself in my cover letters and in my CVs. Please, toot your own horn and write exactly how much you've done. I think especially for women a lot, you'll say, oh, I kind of did this small piece of work. If you've got a certificate, if you've done something amazing, write it that way in your CV. People underestimate how much value that adds, and you should really, I don't know, push yourself to think about your achievements and the way you present yourself. So yeah, those are my main worries, and they were all kind of unfounded. And I think it will be the same for a lot of you as well. It doesn't matter how competitive. There could be 5,000 applicants. Just believe that you're capable of doing the job and focus on yourself. And yeah, just one other thing I'd add, because I feel like it really affected me, was having friends that were starting the same process and getting their jobs really quickly, particularly because they were maybe going for lab roles or something different to what I was doing. It wasn't the same process and it's not the same interview process, and that would make me incredibly nervous. But I think everyone needs to just focus on their own journey. It's really difficult, but your experience of your graduate job search will be very different from your best friend who's on the same course. So I think that's also, yeah, really important to remember.
That's great. Thank you very much. That's a really, really sound advice. And then for those of you on the call that were actually at the roundtable networking event that we had on at the beginning of the week, similar things were being said by all of our employers. So thank you for all of your answers there. I'll pass you over to Lorna. Thank you.
Thank you, David, and thank you all three of you. So Tino has set the next question up really nicely. So what I would like you to do in the same order again is describe the hiring process for your current position. So Ina first.
I think I personally got a bit lucky with my hiring process because the people that hired me is basically where I did my placement. I don't like to really particularly say this, but I felt like it was a bit earmarked, the position that I got. I believe I really worked hard during my placement. It was 37 hours a 37 hours a week, full-time job for 12 months unpaid. So, but I didn't think of myself I'm just a student. I'm gonna just shadow. I really kind of integrated myself into the team and step up when I needed to. And I think that made them feel like I can be a good permanent part of their team. And that's when they offered me the job. So I already told them that I was looking for jobs when I graduated. And I think that's where the time they said that maybe it's time to offer her the permanent role. I still did my interview. Um, and I still had to send an application form, but they didn't really kind of grill me during my interview, which is really great. So yeah, so for me it was a bit smoother, and like maybe other people might have it a bit harder. So yeah, that's my.
It's interesting to hear, Ina, but I think you probably had an entire year's worth of grilling as an interview. So that's how I would see it. So definitely, if they didn't want you, they would not have offered you that job. There's no earmarking there.
Yeah,
So it's
I
a
think
nice
I had a year of like,
yeah,
proving myself,
a
basically.
year to prove. Yeah.
Yeah.
All right. Thank you for that. And Joel.
So effectively what my hiring process was is that so once I graduated, I just applied for this job and then I got my band 3 job back then. And then I started, I worked my way, I was a lot of stars aligned in a weird way. A few people left a lot further above me, and very quickly I ended up going from being the newbie in the department to still being the newbie, but starting to run a lot more the department than I initially thought I ever would. So then naturally when some more roles came out, they were kind of like, oh, Joel, you should probably apply for this. That would be quite a good move. And then I was like, oh, sure. And they were like, oh, yeah, did you know it's internal too? And I was like, okay, let me apply for it. And then so that's when I then became point of care coordinator. Um, After that, there was basically, and I was doing point of care, but I was also still doing a lot more general pathology as well, just because it was at a time where we were relying on a lot of agency staff. Then as time went on again, there was another role, band 5 role. They were like, oh, Joel, you're doing your portfolio, you're also doing this. Do you want to apply for that? And then this time I was like, are you sure? Like, do you really want me to apply for that? And they were like, yes, they should. And then I applied for that as well and got that. I think, it's really similar. Like they kind of I was kind of, at least the second one, they kind of pushed me along the plank to really apply for that one. But I certainly don't regret it. I think the most important piece of advice here I can give you people is do not doubt yourself in any shape or form. You're probably a lot better than you think you are. Especially there was one interview that I had to do to someone, and then I had to be like to her, look, you're a lot better, because she kept on downplaying herself after every question. She was like, oh no, I'm talking too much. And I'm just like, no, you're really good. You actually don't sell yourself as well as you potentially could be, because you don't realize how good you are. So I think my interview process were just loads of interviews as well, but I think also as a piece of advice, don't forget how good you guys are at your jobs.
I love that answer, Joel. I love Joel's description of feeling like he was being pushed along a plank, because sometimes I feel like that with our students, Joel. I feel like we're saying to them, you've got to come off the end of the plank because you will fly. And then they say, no, but I'm going to drop in the sea. And I say, no, we're going to push you along the plank and then you're going to fly. And it's about that self-confidence, isn't it? So, yeah. Okay. So thank you, Joel. Tino, your experience of the hiring process.
Yeah, I think I'm not sure exactly what the hiring process would be like if you started for lab roles straight away, but for industry, there's usually multiple rounds, which can be very daunting. So for Patheos, because it was a smaller company, I went through the Bright Network, which if any of you have heard of it or haven't, it's definitely worth signing up. I think it's a really accessible version of recruiting and very transparent for students about what goes on. So you'll see job applications come up along with the deadlines. And for me, you can take a look through the job description. I thought this sounds like something I'd want to do. So they already have your CV on file, but usually you make a little cover letter, which is like a paragraph about yourself and a bit more catered to the role. So I put that in, and similar to Inna, I had like 14 other things that I put in. So in all honesty, you don't feel as emotionally attached until you hear back about interview, and then you start doing a little bit more research because you're applying for so many different things. And then I heard back about getting to the interview stage, which I was very nervous for because it was with some of the senior management team. And so do your research. It's really important to learn about the company that it is, the people that work there, their work experience that they've had. So, I had all of these stats memorized and things for the interview, but it was actually just a conversation about myself, what I enjoy learning. And it was a really short interview process. And then there's another round of interview, and you have to do a presentation about a specific topic, as well as answer questions in a panel. So I think that can also be quite scary. Luckily, it was on Zoom for me, so there's a little bit of a barrier. But again, about selling yourself and being able to answer questions authentically. And interestingly, our company has a really big focus on culture. So we also do some assessments about your personality style, which can feel like you can get it right or wrong. You can't. It's about understanding the type of individual you are and how that works with a team. No one's the same. So I think that also made me a little bit nervous that there's a right way to answer this. But I would just recommend that people just be themselves, because you don't want to portray yourself a certain way and get into a role that really doesn't fit you. But it was a lot smoother than some of the other roles, like consulting and pharma roles can be 4 or 5 stages of different interviews, which can be incredibly tedious. So yeah, it was quite a quick process, and within a few months I had the role, and I'm working with a great team. But yeah, I got to meet a lot of the people I would work with early on. So another piece of advice when you're going through this process, you should also think about what you want. Is it the company that fits you? Is the level of diversity right? Are there enough people that I feel like I could get on with? What have they said in the role? I think it's also important to consider, are you able to get compensation for the kind of work that you're doing? Does it fit the career path? Do they give you growth opportunities? Yeah, because I think we spend a lot of time, like Joel said, criticizing ourselves and not thinking we're good enough, but you also need to make sure that that company is a fit for you and you're going to enjoy spending 8 hours of your day every day being there. So
that is lovely. Thank you so much. It's nice to hear it flipped, isn't it? That actually there's a little bit of interviewing the employer in a way to find out whether this is going to be a fit for you, because it has to work for both sides. So really nice. Okay, thank you. I will hand over to David.
Great, thank you, Lorna. And again, so much of this is resonating from the event we had last week with the networking event. So those of you that were on the call and went to that, again, the other employers were saying exactly the same thing. You are interviewing the company to make sure you want to work for them in the same way. Okay, doesn't matter if it's a private company, it's the NHS, whatever it is. You go for an interview. It doesn't mean to say you have to say yes at the end if they give you that job. You can say no if you don't feel it's the right fit for you, and be bold enough to say that. Okay, so the next question is, often students understand this process, and a lot of this stuff is familiar, but the thing is, where do they go to get these opportunities? So if you were to advise a student at level 6, a recent graduate, where would you suggest is the place to go to find these job opportunities for them to apply for? So Inna.
Yeah, so for me, I would actually say look at your network. I think for me that is the most, like, that would be the easiest way. If you know someone that works in a place or an industry that you want to work in, ask them about it, ask them about vacancies. I think having that connection is like the easiest way, or I wouldn't say easy, but like way to kind of get into a job because they can kind of vouch for you, or because the employers know that you know this person, that maybe they like this person, they're like maybe their friend is also like them. It's just easier to get employed if you're already in the circle. So check your network, check your, maybe your mom has a friend, um, talk to them about it. I think for me that would be the number one. And if you want to get into biomedical science roles, I specifically I would check the specific hospital websites. I think people just go into like NHS jobs website where they actually post the vacancies, but some of the roles that are in specific hospitals are not posted there for some reason. So if you don't want to miss out on those, check specific hospitals, check NHS hospitals around you, near to your house, and just check for vacancies. Even GPs, sometimes they've got kind of good vacancies. If you just want to get your foot in the door at NHS, that would be a good place to start. Also, like Bright Network, I've heard about them. They're amazing. They also have a wide kind of, it's not just specific to STEM. There's loads of different kind of roles that are, vacancies are available there. And I would also use the university employability services for sure. That's where I got mine. So I'm not gonna not say that for sure. But yeah, and just really open, like LinkedIn as well as another place to go. But the thing with LinkedIn, I think there's just so many scammy kind of vacancies, or some people DM you and you kind of feel overwhelmed, and yeah, maybe focus on more concrete kind of websites. That would be my advice for that.
Great, thank you, Ina. So just before we move on, I've just put in the chat as well, for biomedical science students, there is a student membership to the IBMS, which I really support you go and have a look at. It's not a great deal of money. You have an access to the year and you get more information behind the scenes rather than just the public-facing IBMS website, and it's a great resource. The other thing as well is loads of you at level 6, this morning we had an external speaker come and speak about LinkedIn itself. So someone from LinkedIn Marketing runs her own LinkedIn company. And it's all to do with how you portray yourself on LinkedIn and the rights and wrong ways of doing that. So if you haven't attended online because it was in your timetable, there is a recording to that in level 6 project module. So please go and look at that. It's a great resource. Okay, so Joel, what was your experience with this? Where would you suggest students go to?
So there's two different, so we've got NHS and we've got private, basically, is what our two sections are. The NHS is, as you guys have probably been aware over the past few years, a lot of scrutiny has been placed on the way we hire people. So the NHS, the easiest way is literally just go to their website, apply. Any hospital, if you just drive past a hospital on your way to Asda or something, just apply to them, just see, oh, I've never heard of St. Helier Hospital in my life, or I've never heard of Queen's Hospital Romford. Just think, oh yeah, I'll just apply. There's no harm in applying to these hospitals. The other part of it is private companies. I've not worked private, but I do know a lot of my suppliers and representatives tell me about all their experiences. And with private, network as much as you can. Network. Find out who these people are. Like, they can put in a good word for you. Even if you just mention what you're doing in your project, they might take an interest in it and they'll remember you for that reason. They might look out for the paper that you're going to be writing. So network as much as you can, and just look. It's a lot of you doing it. The jobs don't always come to you. You're gonna have to go out and find the jobs. So do that. And I can't emphasize enough, even within the NHS, once you've got your foot in through the door, networking within your organization is really important as well. Knowing who your senior managers are, not even just for job opportunities, but even just opportunities in general. If you learn what consultant might be interested in, like for me, like there's a brand new metagenomics project. I think just speaking to these doctors that might have interest in that sort of stuff is something that's likely to get them in wanting to involve you in it, and that'll be really good for your professional development afterwards, because Something people don't talk about IBMS portfolios a lot is the portfolio is not all the work. You've got to do your CPD afterwards. You need to keep doing your CPD constantly. So you need to look at these opportunities because you want to stay at biomedical scientists as well.
Thank you very much, Joel. Tino, what about your experience? Where do you think people should go, especially with, slightly different to the NHS from more of a sort of commercial aspect? Where do you think people should be looking?
Yeah, I think it's still quite similar, honestly. If you do have people that you know in your network, then please use that. And I think people feel like network is cold emailing. Even your supervisors and your lecturers or the lecturers of a module that you're really interested in, go and speak to them after the lecture and ask about the types of roles that there are, and then see if there's people in the university who've had that experience. That's a great way in. And I think also your family and friends network is probably more varied than you think. I had a lot of experience when I was originally looking at genetic counselling of mentioning it to someone who's a friend of a friend or your mum's friend's son who's actually doing the exact same course, and getting that number and sending a WhatsApp message of, hi, I'm about to graduate and I'm really interested in this role. Would you be able to have a chat? It's less intimidating because it doesn't feel like it's someone that you don't know at all. And the information that they can provide over a casual 5-minute chat could change how you write your cover letter and get you to the interview, which is kind of, I always think, the biggest hurdle with job applications and applying for job roles. Alongside that, for me, the Bright Network is always the first thing I recommend to people, just because it's so well structured, and they also give you advice about your CV and can review those things, and you can see it sector by sector. So I think if you're feeling like you want something a bit more varied or are unsure, it's a great place to start, and explore the roles and read a little bit about them. I agree. I think that LinkedIn could be a useful opportunity, but there's a lot of noise to get through. And it also is very dependent on how you present yourself on LinkedIn, because there will be legitimate recruiters that might find you on there and present opportunities. But if you do get those kind of messages, you take the name of the company and go and have a look at that separately on different websites and make sure that that's a legitimate recruiter. Maybe call someone or email someone if you're unsure, because there can be all sorts of scams or things that aren't necessarily very useful. But I do think once you've got your first role and you've updated your profile, there will be a lot more of the recruiters or other companies that are headhunting through LinkedIn messages and things like that. So maybe not necessarily at the early stage. And then I also think in London, particularly, there's so many networking events and careers events for uni students. And I think sometimes they do cross university careers opportunities as well as just Westminster. So take a friend and go and have a look around, and there'll be stalls, there'll be people who know people. You just don't know where those opportunities will come from. But I don't know who was who said it, that the job is not going to come to you. Unfortunately, it is a lot of work, and it can be really tedious when it's just staring at the screen. So I think if you are someone that feels comfortable and extroverted enough to go to an in-person event, then definitely do that, and you'll find lots of opportunities. So yeah, that's where I think also if there are specific companies that you are interested in because you know enough about the sector, you can always go onto their websites, into the careers pages, and they'll have a list of vacancies. And if it looks like there isn't anything, there's nothing wrong with emailing and saying, when does your graduate scheme open? But that can also feel a bit disheartening because you won't always get something back. But yeah, definitely checking all of the websites of your top companies.
Brilliant, thank you. I think that's really, really good. And that actually, each of these questions, you've all got very similar type of experience and answers. And I think there's sort of an overarching message. And the overarching message here, I think, for this is about the fact that it's exactly as you said. Things are not just going to turn up on your doorstep. You've got to go and get them. Okay, and you being proactive and doing it is the important thing. And again, we've had a number of events where this is a common theme. Okay, thank you for the questions in the chat. We will come to those questions and answers as we go through, so please do keep typing away. We haven't forgot you. Joel, what about you? Sorry, no, we've done that. Sorry, no, we've gone through all three. Lorna, it's because everybody's moved around on my screen. Sorry, Lorna, back to you for a question.
Oh, lovely. Yeah, they all move around. You can't keep tabs on them. So this is going to be, I think, quite a quick one to answer, but in the same order. So Ina, then Joel, then Tino. Was there anything, or is there anything on your CV that you think gave you the edge when you were trying to break into the job market? So Ina first.
I think for me, I've got now 2 hacks on my CV. The first hack is my technical skills, which especially when I first applied for my placement role, I got a lot of stuff in there, even though it's just university experiments. So I did pile up, I written down all the experiments I did from my first year until the time I was applying, and I just wrote, even though I just did it for a day. I remember we did like a voluntary DNA extraction for my second year, and that's on my CV. I did it for a day. I'm gonna write it there. I did it. So people might think, or you might think, I don't have any technical skills. You know, you don't remember, like I don't have an experience in a real lab. Well, university labs is a lab. If you've done something in there, put it in your technical skills, and that's what I did. That's why I've got loads of technical skills in there. And also the second hack is, don't forget or don't sleep on non-science roles, if that makes sense. I had to work as a receptionist in a restaurant. I worked as a barista as well. There's a lot of transferable skills that you can put in your CV, like time management or team working skills that you can put in there as well, and elaborate maybe 2 or 3 points that you can explain how you did it. But yeah, don't just focus on just science or lab-based experience, because you're going to start panicking if you're a student, you've never worked before, stuff like that. Think about those projects that you've done with your colleagues, with your colleague, like student. Sorry, I can't speak. With your fellow students. Yeah, so there's a lot of things that you really just have to dig in and think about that you can actually add in your CV. So yeah, so I think that's the 2 things that really made an edge on my CV without having like a big science lab role. So yeah.
Awesome, thank you, Ina. So what Ina's saying here is actually very important. Lots of you have experiences, even if just volunteering experiences or paid work, where you are getting lots of skills. I spoke to a student recently who was doing manual handling. So there was all the manual handling training, lifting, health and safety. There was a bit of electrical work in there. All of that requires regulatory understanding a little bit of. So all of that needs to go in, not just, oh, I'm not going to put that in because it's not relevant. It is relevant. So that's a really important, Ina. Thank you. Okay, so we're focusing on anything you think in your CV that gave you the edge. So Joel.
You mentioned manual handling. It's become the bane of my life because they keep getting onto me for wanting to do that training. So for me, again, I think there's 2 things that stood out. Like, it depends. My later jobs are a bit different to my older ones. My first one was actually when I used to work in retail. I think that was a big impact, being able to deal with people, which you think biomedical scientists don't always do it, but we do, because patients are always calling, complaining, crying, saying that they've been diagnosed with cancer and they don't know what to do. And then you're on the other side. You need to know how to let them down gently without telling them anything. So that's actually a lot of good skills. And then another one is, I don't know how I did it, but somehow or the other, my name ended up on a paper somewhere, and I've been leeching off that ever since. So do that. Again, it's going back to networking. If you know people, you get access to these opportunities that you can then throw on your CV that then look absolutely amazing to when you want to make the next step. So something to consider.
Thank you, Joel. And Tina.
Thanks. I think for me, similar to what Ina said, my skills and my key skills are at the top of my CV. And so what you're doing there is saying, these are the things I'm good at, and then where have I applied that? So rather than just my work experience. So for me, public speaking, I think, is one of the edges that I have. It's something that I've developed through lots of different areas, and it's something that I find useful in job applications. So for me, linking that back to my university experience, the Co-Creators Project, which I did, was an incredible opportunity. Not only are you doing independent research outside of your role, it's multifunctional across different areas, but I also got to speak in a podcast because of it, and that looks great on the CV. It shows that I'm taking something that is a skill or a passion and then practically applying it, using it to further develop my professional skills. And that's something that they'll want to see, like someone who can innovate or develop an idea into something that's real. So that's definitely something that is quite high on my CV and that I'm really proud of. But also for me, captain of the rugby team is something that I was incredibly proud of. And if you think about the skills that you develop from that, managing teams, managing stakeholders, reporting lines, financial reporting, developing social skills with other team members, the way that I write that on my CV, I think helps a lot with my profile, or at least when it was early on in my career and I didn't have any industry experience, because that says a lot about the kind of person you are. So I definitely think if there's societies or key interests that you've taken from something I like the idea of into an actual club or a hobby or a skill that you've developed, then definitely make sure that's front of line in your CV as well. And I think it's important to have a little bit about you as a person, because in all of my interviews that I've ever done, they will mention those personal skills at the bottom of, oh, you do rugby, or oh, you like to do this other thing. I know people who do social media and influencing, and that is actually an incredibly important skill. Like, can you imagine if you're going into pharmaceutical marketing, your ability to understand public relations and how people interact with social media is an important skill that our generation is really good at without trying. So if you were to manage those kind of accounts, or you manage the social media or social sec for one of your societies that you're part of, even if it's not relating to biomed, that's something that you should flex on your CV as well. So yeah.
Definitely. You're right, Tina, in that the young ones, you guys, there's lots of things that you've just practiced through living that perhaps the people hiring don't have as easily. So sell those things, definitely. Okay, over to David.
Great, thank you, Lorna. And this is a fantastic session. I think this is probably one of the best sessions we've had doing this event for Biomed so far. This is brilliant. I think that's a really good set of answers to that, and actually, hopefully, that will help students sort of navigate that field. I think we'll take one more question, and then we're starting to get quite a few questions from the students, especially around placements, IBMS portfolios, and that. So I think we'll spend the rest of the time sort of looking at that. So maybe what is your sort of top piece of advice that you would give to a student navigating careers? So one thing, I think actually maybe if you were on the call a couple of years ago when you were coming towards graduation and we did one of these events, we had other recent graduates and we said the same thing. What would your one piece of advice be? So, what would your advice be to students?
I'd say my number one advice would be don't be picky, especially if you're a fresh graduate. Like, you have to open your horizon. I personally have a regret on this because I said, like I mentioned, I was very linear in my kind of role that I wanted. But don't be picky. Like, Tina is in industry and Joel is doing also something in NHS, but something completely different from what I'm doing. So just apply. If you see a vacancy, if your friend mentions something, even if it's like something completely different, try to kind of expand your horizon. I think that would be my number one choice. You're in your 20s, this is the time that you're really figuring out what you want, what's good, what works with your skill or your personality, and what doesn't. And the best way to know that is to actually try. People always ask me, like, um, how will I know what discipline I want to specialize in? And I would say, give it a try. Maybe have a day in there, see what they do, or just have an experience. Give it a try. I know some people might be, it's daunting. I don't want to give it a try and then regret in the end. But that regret is then that's not for me. So then you move on to something else. Um, so yeah, don't be picky. Just try and apply. Like Tina also said, that don't sell yourself short, and just really flex what you've learned from the whole degree, and with your supervisors supporting you, and you've got the employability skills as well. So you're well equipped. So just don't be picky and try. You'll fly, like Lorna said.
Great, thank you. And again, those of you that were at the roundtable event last week, that was the same thing from people that have been in industry for 20, 30 years. They said, don't sit there waiting for that perfect job to come to you, because 9 times out of 10, it won't be the first job that you get. Okay, go for anything. And also the other thing to remember, once you graduate, if you sit there for 6 months because you're trying to apply for things and not getting anywhere, and then you get a job, maybe sometimes, employers will say, well, what were you doing for 6 months? Why haven't you gone and done something else, or some experience or something that adds to that process? So yeah, absolutely, fully agree. Joel, what about you? What's your top line suggestion of advice for
Um,
students?
So my number one, like the top piece of advice I think is don't stress too much about the content. You guys are all smart. You've all made it to third year. You're gonna graduate. Don't worry about that. It's very easy in level 6 to get consumed by what's going on around you and being scared of not knowing things, and that's absolutely fine. You're never gonna know everything, but I think what's really important is that you focus more on what you the way to say it is that when you work, that will come back to you. Don't worry about it. Quite frankly, I don't remember every single lecture that I had, but when I do go back to it at work, that rings back into me, and you do pick it up. I think focus more on your future and making opportunities, which is what I think is really, really, really important.
Brilliant. Thank you. Absolutely. And Tino, your top advice from your experience?
Yeah, I think I would say do your research. And when I say that, I think externally. So when you see job roles or you hear about an idea that sounds like something you would be good at, it doesn't need to just be one review of the job role on the website. Go and watch a day in the life video or a YouTube video and understand what that person actually does day to day. It's very easy to make something sound great on a job application where they're trying to hire you in, but go away and look at that role and see if it aligns with you. So it's not just external, but internal as well. I think what was really helpful career advice that I got very early on was, what do I enjoy? So what are the modules where I find time flying when I need to do the work for it? Or I'm kind of excited to go into the room and learn more, or ask more questions. But then also, what are you good at? So it is important, the things that you feel like you can pick up quickly or maybe get the better grades in, and mixing those two things together of something that you could find yourself doing a lot, but that you will also be able to pick up quickly, are probably the areas you want to focus on for a job, because you're going to spend a lot of your time doing that role. And I think pairing those two things together of understanding what a role really means, what the terminology is actually about, how much time am I at the desk, how much time do I have to be around people, and does that suit me? Am I extroverted or introverted? Or, do I really enjoy looking into the detail, or do I want to be really high level and doing something with marketing and coming up with big ideas and sitting in a room and brainstorming? You'll only understand what that really means and what these job roles like project manager or marketing or medical sales really mean from going and looking at it. And we're really lucky that we have the TikTok and YouTube and everything else where we can just watch someone do it all day and explain every detail. So yeah, please do your research and make sure it fits with what you've learned about yourself as well.
Brilliant. Thank you, Tina. I think that was really sound advice from all three of you. And the fact that actually, you've been recent graduates of university and you've excelled in your careers and have done this so quickly is amazing. And it gives our students, current students, that sense of direction and ability that, there is stuff out there. It's not all a brick wall as soon as you graduate. That's great. Okay, I'm going to hand back to Lorna as chair, so you can decide what we're going to do for the next section.
Yeah, so thank you, David. So we have got some questions in the chat here. So if it's all right with you guys, we will potter through them. So we have a couple of students asking for advice on how to complete the IBMS portfolio to get HCPC registration if they haven't done a placement. So, I guess they are looking at you and thinking, oh, I would love to do what she's doing, but how do I get there without having done a placement? So perhaps Ina and David might be the best two to have a go answering this one.
So from what I've seen, people usually get their foot on the door through a role called medical laboratory assistant. So that's an MLA post. That's where people start off, and then when you get into a discipline or a department, they will then later on offer you the BMS to progress. Unfortunately, a lot of labs have a queue for the BMS portfolio. So it's definitely something you might want to ask if you apply for an MLA role and you get it, or during the interview, you might want to ask for progression, ask them if you're able to do your BMS portfolio down the line. So yes, so that would be the next step. If you didn't do your placement, you'll have to do it through your MLA post or medical laboratory assistant role. Yeah.
That's great, thank you. And I can add to that, there is also another sort of entry level role into biomed, which is often advertised, which is associate practitioner as well. So normally MLA as AP roles are the sort of entry points into that profession. The IBMS portfolio as well is non-discipline specific. So if you were to do it on placement or in your first job, maybe in, say, cellular pathology, and then in the future you think about transferring into, say, blood sciences, clinical biochemistry, because it's the best subject to do, because I'm in that, then, you know, you don't have to have the IBMS portfolio again in blood sciences or biochemistry. Your portfolio registration means that you can be a biomedical scientist, and then, as Inna is now doing, is specializing within your discipline, and then you do the specialist portfolio to be more discipline specific. Okay. The other thing is that the workforce as well is a dynamic thing, and the IBMS workforce is changing in the future. There is more integration of different disciplines. So blood sciences never really existed before. When I was back in the lab in the NHS as a clinical chemical pathologist, there was clinical chemistry and hematology. Now we have blood sciences, and that is now an amalgamation of the two. Some sites will have also some virology within that discipline as well. So, you know, things are changing. There are emerging topics as well. So the AI is a huge amount of clinical informatics, bioinformatics. These are things that are emerging as independent disciplines within biomedical science. So again, have a look at that. The IBMS have responded to the government and the NHS long-term workforce plan, which is all information that's available on the IBMS website. So you can go and have a look at that. And it looks about how biomedical science is going to shape in the next 10 years. So again, guys, if you go and have a look at that, the fact that you've looked at it, you can mention it in an interview. That's going to set you apart from someone that just says, oh, I did this degree and these are the modules I did. Okay. Know about what the future is. This is important stuff. Okay. So Lorna, back to you.
Lovely. Thank you, David. So that was lots of information. So just remember, there is going to be a recording of this. So if whilst our panel are speaking, it's all going too fast and you're thinking, oh, I can't capture this, there's lots of information, I understand it's very rich, the information, you can go back to the recording. So not to worry, you'll be able to do that. So on a similar note then, still about the IBMS, we have a few questions. So somebody is asking about the IBMS student membership. And the question is, if we do have this membership, what does it do for us? And how does this membership help us compared to if we don't have it? And this question is directed to David.
Okay, thank you, Lorna. So if you take a look at the IBMS website and you go to that link I've sent you, it tells you on there what are the benefits of having a membership. Okay, and there's various different things. It allows you to see behind the wall of the public-facing IBMS portfolio. Okay, sorry, the IBMS website. Secondly, there is access to the online journal for the IBMS, which is called the Biomedical Scientist, which you wouldn't have access to. In the back of that, there is often job adverts and a section on courses. The IBMS often have ring-fenced student employability events, online events. There is a very active Twitter feed. There are question and answer sessions with different members of the IBMS online, and you'll have access to that via that portal. It also shows as well, if you have that on your CV, that you are a student member of the IBMS. Again, it's another evidence to say that you've got one foot in the door. Okay, just saying I have a degree in biomedical sciences is not enough. Okay, you have to demonstrate. And as we've spoken this morning very eloquently from our three panelists, that it's not just about your academic ability, it's more about you as a person, the rounded you. Why are you interested in this, and what's the thing that you want to take forward? So the more you can put in there to demonstrate your commitment to the particular profession and your diversity within the profession, that's where things will help you. Okay, so do have a look. I think as far as I remember, I might have a quick look. I think it's around about £12, £15 for the year. It's not a huge amount of money, but it's worth having. Okay, there's also lots of different things like student prizes. So in fact, actually, we have within the school a prize for the best IBMS student. Okay, but you have to be a BMS student, but you have to be an IBS member to have that for level 6 when we get to graduation. Okay, does that help? Lorna.
I think that answered it quite well there, David. Don't worry. If you're finding that our answers are partial or you need a bit more, just pop it in the chat and we will come back to them. So if you've got follow-on questions, just put them in the chat for us. I'm going to stay, I've got a couple of questions for specific panelists, but I'm going to stay with this placements thing a bit more and the IBMS a bit more, because we've got quite a few around that. And really this is, again, for Ina and David, I think. So it's about, how did you find the placement? And I think Ina might have answered that because it was through the university, wasn't it? Through our placements. Yeah. Okay. So that was through our placement application. But this particular student is saying there are only a few advertisers at the university, and I can't seem to find any on other websites, and they're feeling like it's limited. So the advice here is really, how can we get placements if we haven't gone through the standard route? Is there another way? And also, will you still have the chance to get into a diagnostic lab if they haven't done a placement year? So
okay, so can I maybe just kick off with that, obviously from the university perspective, then maybe Ina can come in separately. So I think, Ina, when you did yours, you did the placement, you did the 4-year degree from the outset. Yes, that was right, wasn't it?
Yes.
Okay, so we have changed recently. Okay, so everybody now comes in on a 3-year route with the option to go on to the 4-year route if then a placement becomes available and is successful. Okay, so we've changed the setup. And for level 4 students, there is no change in the structure. Level 5 students, there is a placement workshop that happens in October, November time, and an expression of interest form, which then puts you in the sights of the careers team, because we can't have all 400 and something of you saying at the last minute, I want to do a placement. So we have to have some regulatory processes to allow those that are interested in placement to then be targeted, which is how we first start that. We have a significant number of placements in and around London. We have placements also outside of London. I think that one of the issues that we have is that we have a very London-centric student population that wants something that is literally 5 minutes down the road. Okay, so that's not going to happen. Okay, and again, also thinking about jobs as well. When you look at biomedical sciences, I did a quick search last week on the IBMS, the NHS jobs website. There's something like 1,400 biomedical science positions across the different grades in and around the country. There's a huge amount out there, but you have to consider whether or not you're going to have to move further afield, or consider maybe commuting as well. Okay, I commute into Westminster from Hampshire. It's a long way. I have battles with trains all the time. Okay, I don't live 5 minutes down the road. Many people don't live in central London, and that's the way it is. Okay, again, people on placement have a bit of a wake-up call with this as well. So secondly, the other thing is the biomedical science positions that we have with our partners does fluctuate each year. So 1 year we would have maybe say 10 or 12 positions, say with South West London Pathology. The following year they might only offer say 2 or 3 or none at all, and that's because they have also internal members of staff that have to go forward for, as Ina said, for IBMS portfolio training and moving up the scale. So it's a fluid movement. We don't have a set number each year. The other thing as well, which I think is really sort of a confusion, is this word placement. Okay, I don't like this word. I think year-long work experience is the way to look at it. Placement sort of suggests that you come to us and say, I want to do a placement. We say, right, we're going to place you here. That's not how this works. Okay, you have to go through an application process in the same way that you would do when you graduate and go for a job, and you would be interviewed by the placement, and they would then be the people that will choose who they want to have on placement for the year. It's up to them if they do that. It's also up to them if they put you forward for the IBMS portfolio. So even though the placement is offering that, if they consider that you're maybe incapable of doing it, or there is some problem and they don't want you to do that, or they feel that you are not quite there, it's their decision to put you through the portfolio, not the university. It's not a requirement. We also have some placements that don't have training status as of the laboratory, so they would offer you a placement but will not give you the portfolio. That is still an entirely suitable placement to have for the year because it's giving you experience. Okay. Secondly, how do you get into doing this if you don't have a placement year? So as we've said already, you should be targeting jobs that say medical laboratory assistant or AP positions, associate practitioner positions. Those are the entry job levels, and you would then be considered further down the line, depending on the structure of the hospital and the pathology services, of whether they will allow you to do that as part of an MLA role, or you then maybe have to apply for a trainee biomedical scientist role once you're within that setting. Okay, so there's different ways of doing it. For those of you that are interested in maybe considering, as Tino is looking at sort of wider industry, then there's lots of different options. Again, there's the Westminster Engage. There's options that we have for placements outside of biomedical science diagnostic laboratories. We've advertised a huge number of those online. There are also external parties such as GradCracker. So for the guys that are on the call, probably didn't really know about GradCracker because we weren't really partners with them when you guys were studying. But for those of you who are current students, we've introduced this from level 4. So GradCracker is a recruitment platform specifically to do with STEM related industries. Okay, so as people have said on the call, people with a biomedical science degree doesn't have to mean you go to work in biomedical sciences in a diagnostic laboratory. You can go into all sorts of different things. Okay, and these are things that are open to you. Janet's just very lovingly put the GradCracker website in the chat for you. If you haven't got an account, go and have a look. It's a fantastic resource. Okay, so advice, use that. Okay, speak with the placements team, last placements team on site, or via an email or the student hub. Okay, and there's also a lot of different resources for looking for placements outside of diagnostic laboratories. The diagnostic Path Lab placements will not be advertised on the likes of GradCracker. They will be advertised either directly via the universities or via the NHS Jobs Net website itself. Okay, so hopefully that's a starting point for you. If anybody has anything further, then either put it in the chat or you can email me directly to my Westminster email. Lorna.
All right, lovely. Thank you, David. So again, there's lots of questions going in lots of different directions here. So we'll change tack a bit and maybe move away from the placement ideas. We can come back to it if you guys are still hankering for more information. But I've got a specific question for Tino. So it says to Ms. Rodvizi, Tino, what sort of experience or skills do we need to have to enter or excel in biotech? And is an internship a must for these biotech companies?
It's a good question. I think, like I said, it depends on whether you want to go for a small or medium sort of biotech company or larger scale, because they do sort of range. You do get biotechs and drug discovery companies that are much larger. I'm sure at some point in the module we'll go through the drug discovery pipeline, because you have companies that are still looking for molecules at a much earlier stage, maybe slightly less investment. And I would say in those kind of companies, your main skills should be around your ability to be organized and manage multiple tasks. If you're in a role like mine, which is more so project management, I spend a lot of time across different experiments that we contract out and making sure that those are running smoothly, and then being able to report that back up the chain, as well as financial reporting and legal and stuff. So I think being organized and being on top of your time and your tasks is really important. They're usually very fast paced. You have to make decisions quickly because ultimately you're trying to get data to get more investment in order to make a treatment for patients. So I think that's an important skill. I think your ability to manage time pressure is really important. The larger up the scale, you can kind of be more functional. So if there's a specific area like clinical, I've found really interesting. Maybe having some experience from your optional modules about clinical in general would be really helpful. Clinical operations, or just how clinical trials are run, ethics across scientific experiments would also be really useful. If you can get any experience about, for my role, project management, I didn't even know how really a Gantt chart works until my 3rd year at university and what that was. And it's actually really useful. And I find a lot of businesses and industry use business terminology, which can be confusing at first. It's very simple. It's just, people throw around words like stakeholder and all of the sorts of things that you've never heard before. So spending time on that. Do you need to do an internship? I think it's incredibly helpful. The professional environment and corporate environment is different to school and university. So it can be helpful to experience that and navigate teams and meetings and things like that if you get the opportunity. I didn't have a formal placement for a year in industry, and I was nervous about it, and it didn't affect me. What I did do was the extra projects with university, because it just shows your ability to apply all of the soft skills that you'd need about organization and things like that, away from just being forced to because there's a deadline on my degree modules. And I think also I did the Bright Network Internship Experience UK, which is a very short summer online internship. So there might be opportunities to do something that's shorter, and there's maybe a higher opportunity of being able to get accepted for that. And it taught me a lot about just corporate environments and industry. And I think it lasted for about a week. I'm pretty sure they still run that every year. So you might want to take a look at that, because they section it by sector. I think that was just a great intro into industry without a really laborious process and potentially getting declined from more competitive experience. And then I think other skills, I think presentation skills are really important as well. You spend a lot of your time making slide decks and relaying information, and your ability to read scientific information. I think Ina mentioned that before. Although I say I'm not very close to the science, I spend a lot of time reading clinical protocols, investigator brochures, which are incredibly large documents filled with data that you apply for your application. So attention to detail is really important. We still need to read journal articles or information from our competitors. So the ability to understand, okay, this is the abstract. If I've only got 5 minutes before the meeting and I need to explain what I think I might have seen and dive into it again later, but being able to sift through journal articles and understand what the scientists on my team are talking about and how to relay that has been incredibly important as well. So I know I said a lot there, but hopefully that gives an idea of the range of skills that can be useful.
Brilliant. Thank you so much, Tino. So there's another question here which is related. What are some entry-level roles within the biotech industry?
That's a good question. And I still feel as though it's kind of a bit of a black box in biotech. I don't think they spend a lot of time catering towards graduates necessarily. I think biotech is also really broad. If you wanted to go into a drug discovery company or VC-backed company or pharma-backed company, my role is a great one. It's called Biotech Associate, but that's very specific to the ecosystem that I'm in, where we're a company of 4. And so they make this role that's slightly more broad and covers a lot of different areas, and it develops as you go along. I'm sure that there'll be most things that are similar to that in smaller biotechs, where they kind of want someone with a scientific degree, and the opportunity is then to support on smaller projects and then develop as you grow. I don't know if we actually have any that we're hiring for in 4 companies within our ecosystem at the minute, but you would see them on the usual websites. And then outside of that, for pharma companies, they'll have different names, but it's all essentially the same thing. They have graduate schemes. So you'd apply within, I think it's September or January, they kind of have their role of graduate opportunities that come out with rolling deadlines. So look out for those graduate schemes that will come from the Johnson and Johnsons or Pfizer's and things like that if you want to go down the pharma route, and you can go through the process that way. What else within biotech? You can work for contract research organizations, which I haven't mentioned before, but those are organizations that run a number of different types of experiments, all the things that you learn about in your current modules, anything from histology to RNA-seq, and those kind of places will be hiring biomedical scientists or other such scientists to work in the lab. And again, that would be by going onto their websites and looking for entry-level scientific positions that they'll just advertise them that way. So it's a really big sector, and they don't talk much about it till you're in it. So I think that's the best way. And like I said, the Bright Network, and I'm sure GradCracker will probably have something similar, where they all have very different names for what is essentially an early stage graduate role. So
Brilliant. Thank you so much, Tino. This is really important, rich information for all of our students, because they haven't experienced what you 3 have experienced. So a question for you, all 3 of you then, in order. So Ina, Joel and Tino, we're nearly there now because I know you're probably getting tired. How did each of you articulate your skills from your modules onto your CV? So how did you sort of think through that? Ina gave us a little bit of that before. So Ina, how did you do that?
I think I would still say the same thing. I really had, I think it was a advice from a friend of mine to say that I should take notes of all the experiment that I'm doing, because I know down the line I want to focus on being in a diagnostic labs. And I think like my focus then was like, I need to have technical skills. And so I really also did enjoy a lot of hands-on experiment. I'm more into like doing rather than the theory side of things. And I'm a visual learner. So being able to see it and do it, like that sticks in my head. So yeah, it will be the same thing, like everything that we did in the modules, like having the lab experiments. That's what I kind of used to leverage my CV basically, because like Tino, that was on top of my my CV as well, the technical skills. And because the thing is, I believe that just have to kind of advertise yourself through your CV and get your foot in the door to get the interview. And once you get the interview, if you if the if you got the right fit, then your personality would kind of match with the employers, and it will just go from there. So just get your CV right, put a lot of your technical skills in there, like I did probably. And yeah, that's how I translated my modules into my CV, more the technical skills. Yeah.
Okay, thank you, Inna. So Joel, what did you do to get your university modules into your CV?
So what I did is mostly the technical skills again. So the minute you write biomedical science on your CV, that's all the employer now knows, that you know your stuff. That's pretty much given, because if you pass your degree, they know that you know your stuff. What they need to know is how good are you in the lab, how much of a reliable person you are. Do you know what these techniques are? Can you do like special staining, for example, and all that sort of stuff? That's what they want to know. So put that near the top, because if the employer gets bored reading your CV, they're just going to scroll right past it, and then right at the bottom, they're going to score it 2 or 3. They're not going to score it high. You need to write the important stuff. Always go from the most recent to the end. Don't go from where you first started. Always the most recent near the top, and always hone on your skills, because this is what the employer wants to see.
Thank you, Joel. And Tino, how did you get your university modules into your CV?
Yeah, I think I'm sort of echoing what the others said. I had, like Joel said, please make sure you put the most recent at the top. It's also important to think about the fact that most recruiters and companies do have different kind of computing systems that look for keywords in your CV. So make sure you check your CV regularly for the type of role you're going for. So I had my degree at the top and then key modules. So for me, I put like my clinical genetics modules, clinical biochemistry. Those I put 2 or 3 out of the optional things I've done, or the mandatory, that I think were the most relevant or relating to the roles I was looking for. Obviously, they can see that your degree's at the top, but it's an extra line that doesn't take up a lot of space, that just maybe shows your key interests a little bit more. And then I think separately, when you're just going down your experience sections, it's fine to list the types of skills. So I've done protein modeling, or I've conducted multiple scientific experiments. I've got an apt understanding of whatever it is. Writing it in that phrasing is more active language that shows that you have those skills, because you do, like we said before, there's nothing wrong with saying that I have an apt understanding of RNA-seq. If I've done a module and I did those experiments and that's something I feel like I understand really well, then write that on there and make sure that that's a highlight. And then similarly, I think if I feel like I've got great public speaking or presentation skills, well, when have I done that? Usually when I'm writing a cover letter, or I work with other people and try and help them through their CVs, that's what you think of. I think I have this skill. Give me a couple of examples where you've done that, and be able to phrase it that way round. I know there's lots of different models like STAR and everything else, where you say the skill or the statement and then think about, okay, what do I have to back that up? And it can be as small as, I worked in a nursery, so I know how to create a protective and safe environment, and, organize days and liaise with parents across difficult subjects and conversations. Or my communication skills, I take large amounts of data and, realign that for smaller presentations. I think any of the modules that you guys are working on, you spend a lot of time doing the skills that you'll do throughout, and writing it out in a sentence or phrasing it alongside, those key buzzwords about organization or anything else will be really useful. And if there's specific kind of softwares like Ensemble or other things that you use for your degrees or for your research project, you can also put that in like your key skills, or maybe softwares that other graduates might not have used if they didn't do the same degree as you. So it's worth flagging that as well.
That's brilliant. Thank you, Tino. Yeah, so that advice, guys, about claim a skill and evidence it, be able to evidence it. So it's no good just writing a list of skills. Where have you used that? Where have you acquired that? It's important. So all of you seem to be interested in, a lot of you seem to be interested in whether the panel would recommend an MSc before jumping into the job market. So what do you say? We'll start. Oh, just 1 second though. David's got his hand up. I'm sorry, David. What is it you wanted to say?
Thank you, Lorna. I was just going to say a couple of people have mentioned about sort of bandings and sort of terminologies that we use here, and we're quite familiar with that. And I just wanted to check people understood. So medical laboratory assistant, AP, associate practitioner tend to be band 2 and 3 level jobs, maybe at a push band 4, but normally trainee biomedical science is band 4 and qualified is band 5 and above. Okay, so just so you know the sort of levels of different jobs within the skill set effectively from different levels within that. The other thing, I've just done a quick NHS jobs search. So if you put trainee biomedical, it doesn't always just come up with biomedical scientists, but certainly trainee jobs in the whole of the NHS is 1,263. If I limit that to London, okay, this is where you need to consider your possibility of going a bit further afield. Okay, if I limit that to London, that comes down to 273. Okay, so again, just be aware that you might need to consider moving. You might need to consider whether or not you need to travel some distance and things like that you need to look at. For the website, RFO, I'll put it into the chat for you. The other thing as well is you can, with this NHS jobs website, you can set up an account. It will email you every time a new job is posted at that level. Okay, but a caveat to that is, and I know that it's quite easy to go in and just have a generic CV and everything and just click apply. Make sure that when you're applying for the jobs, you tailor that. So I've had the examples of this before where someone has put an initial application through for, say, cellular pathology, listed all their particular technical skills about cellular pathology, and then they started applying for microbiology or clinical biochemistry, and yet all their skills are not that discipline. Okay, so make sure it's very easy to get into that trap of just having a generic which doesn't give enough information, but then make sure that you are tailoring your application to the job requirements that are given. And when you look at the job, if not on the first page, there will be a downloadable job description, and it will give you essential and desirable requirements of the job. So you need to meet the essentials to do the job, okay, and the desirables, things like, have you got the HCPC registration, or are you able to work towards it because you've got an accredited degree? Then that's the thing that you need to look at. Okay, so just be careful of that. All right, thank you. Sorry.
No, that's fine, David. Good. You've got to jump in there when you can. If I keep talking, I'm sorry. Okay, so just looking down these questions now, bear with me. So yes, this was this question about an MSc. So to all three of you, do you recommend that students do an MSc, or would you say that they can jump on into what you're doing without doing that? What would your opinions be? So maybe Ina first.
If you're particularly looking to go into biomedical science in diagnostic labs, unfortunately, MSc is not very helpful in that sense. I believe from what I've heard and what I've seen, MSc in diagnostic labs is used to progress to a more managerial position or into band 6 posts, to apply to band 6 posts. But to get into this role, like where I am now, you don't necessarily need an MSc for that one.
Okay, thank you, Ina. And Joel, what do you think?
So what Ina said is she's exactly right. You don't need an MSc to get in at the start. However, not having an MSc will catch up with you at some point, because to get to so the way it works, I don't know, each lab's a bit different, but in my hospital, if you want to get to a band 7, you'll need your specialist portfolio. But the way to get around it is if you have a master's, you can circumnavigate the special portfolio and get into your band 7 straight away. The NHS has some weird rules. Some hospitals can't put you on a 6 if you've got an MSc. They have to put you straight onto a 7. That it depends per hospital and depends on whatever regulations are running at that time. But it probably will catch up with you at some point. If you want to get in, you can do it without the MSc. Absolutely fine. like Ina said, you don't need it at all really to get in at the start. But then if you're someone like me that quite frankly probably will struggle to get back into education, if you do need the MSc, I would do it then, just because it's kind of done and out the way. But if you feel you're quite happy getting back into education at the time suits you, then don't do it then, do it later. But it depends on you as a person. Yeah.
That's quite good advice, Joel, that it really depends on you as a person, and they have to know what they want and where they're going. So that's good advice. David, you want to jump in?
Yeah, just to add to that, thank you. Both Ina and Joel have given the perfect answer there. And as obviously the course leader for the MSc course at Westminster, I thought I'd just add into that as well. So as much as we would love to have you just come straight away and do a degree with us as a master's in biomed after you graduate, I want to dispel one myth, and that's that a lot of students think by doing a degree at master's level straight away, they can jump the need for the IBMS portfolio, and that's not the case. Okay, so all you're doing effectively, if you want to work in diagnostic laboratories as a qualified biomedical scientist, remember it's a protected title. You have to have these characteristics to call yourself a biomedical scientist, which is not only just the degree, but the IBMS portfolio and the HCPC. Okay, those three components are required to be a biomedical scientist by law. Okay, so if you have the undergraduate degree and then you go and do the masters, you still haven't done the IBMS portfolio. Okay, so you're going to be then maybe 2, if not 3 years behind maybe those that have done the portfolio as part of a placement, because they've graduated, they've got the portfolio, they've done their HCPC registration, and they've got a year experience, whereas you're doing the masters and then you're applying for MLA, AP positions down the line. If you're considering potentially further career aspects, such as maybe you want to go into a higher degree, such as a PhD, a research position within the field of biomedical science, then the MSc is probably a well-suited route for you, because it builds on the specialist knowledge. So it's not so much the applicability of it for the profession at that level, okay, entry level, it's more for the higher level, as Joel said. So if you're looking at maybe becoming a specialist in an area, which is what Inan's doing at the moment for the specialist portfolio, potentially looking at sort of management routes in the future, levels 7, 8 above. Okay, consultant biomedical scientist is an emerging field now. Okay, so at consultant level, those are often 8 B's and C's, if not higher. I know of a couple of people who are actually on band 9s now, which is quite unheard of for biomedical science. So those are very, very well paid positions, yet they are much more structured towards management rather than actually the discipline and the work on the bench itself. But for those positions, a master's is then required further down the line. Okay, so I'm not doing you disservice and the university disservice by saying don't do it, but consider your options in a timely way, because a lot of students come to us and then think they can bypass that initial IBMS portfolio, which is not the case. Thank you.
Really good advice, David. Thank you. And the MSc is here for you when you want to come back. Yeah. So Ina, you wanted to say something?
Yeah, I just wanted to add as well. I've heard, and I know in my company as well, they're able to fund the MSc down the line. So if you're already working for them and they like see the value in you and see that they feel that you're going to stay with them and they can benefit from you getting your MSc, they will fund it. So don't worry about it too much, I think. Yeah.
Thank you, Ina. And Tina, what would you say with regards to MSc?
I think it's always an interesting question, because I grappled with it for a while. I wasn't sure exactly what I'd want to do for my MSc straight afterwards, so that's why I went into industry. And again, I think because I work with a smaller company, my level of experience has probably jumped in the last 2-3 years. I've had opportunities I don't think I would have had at a larger organization, and done some very cool things which have bulked up my CV to a point where right now I don't feel like I need it. But I think if I was to do an MSc from biomed and it's for industry, you should think about if you want to specialize or narrow the scope of what you're doing for your masters, because otherwise I would think that the roles that you're going for will probably fit what you've already done. And if you're looking at industry, it's much more about experience you learn through doing. So spending time in a company would probably do more for you than just academia will. But in saying that, a lot of the people that I work with that started at the same role as me did have a master's. So I think it's just about, you know, your level of confidence in yourself, and if you're willing to try without that and then come back to it. And like Lorna said, you are all very young, and I think there is a pressure to feel like you have to do it all sequentially in the next 5 years, otherwise it's all going to fall apart. That's not true. Like Ina said, most companies, especially larger organizations, once you're through the door, you might be able to say to them, I want to go and get this further qualification that actually makes me more suitable for the roles and the career progression that you need within the company, and they'll be willing to sponsor that on a part-time basis. And that's all about your engagement with the company and your process with your managers and things like that. But that opportunity is always there. It's also a lot easier to save for a master's if you spent some time getting some money with a salary job as well. So I think if you're not sure and you're feeling that pressure, there's nothing wrong with trying for a year to go for the applications or get some experience or an internship and coming back to it later down the line. It's definitely something I still think about, but won't rush myself into it. And I hope that none of you feel the pressure that you need to as well. So yeah, that's the advice I'd give.
Thank you, Tina. I realised I did that out of order, so I'm sorry, Joel. Would you say an MSc would be necessary? What would you say?
Yeah, I did talk.
You did talk.
Yeah, I did. But yeah, anyway, just to, I think the
Because you
reason
did an MSc with us, didn't you,
yeah,
Joel?
I did. Yeah, I did. Yeah. But yeah, just going back to everything, I think an MSc is very much dependent on you as a person. But for me,
Right.
I think but for me, I think it's definitely helped me, though. I would tell you, that's definitely helped me. It got me to this position, because this position you need a master's to get into. So it very much depends on the lab and your future. But literally, as David said, it's gonna hit you at some point. Probably not now, but if you want to stay in biomedical sciences throughout your entire, well, for a decent part of your career, you're going to eventually hit that ceiling where you need it. But then there are ways to circumnavigate it and like get around it. So it depends on the company you're working for at the time as well. And if you can get the company to pay for it, then definitely do that, because student loans are not a joke.
Thank you, Joel. Yeah, I remember you said it's about the person. I said that's a brilliant answer. I'm sorry. Okay. All right. Clearly, I'm getting old. All right. So we've only got 3 more questions, and they're quite short ones. So we're nearly there. Thank you for your time, all of you. So this is just a little one. Did you state your grades for specific modules on your CV, or would you say that's not necessary? So Inna shaking her head.
No, I don't think I put it in there. I think it's not very necessary. In my country it is, so I don't understand, maybe like from different backgrounds, the grades matter a lot. But I find in London, particularly because this is where I applied, it's not really like a specific thing that they kind of look for. Yeah, so no, I didn't.
Thank you. Inna, what would you say, Joel?
No, I did definitely not do that. And also, they're more concerned with the accreditation. If you want to mention the accreditation, definitely mention the accreditation. That's a lot more important than the grade stuff.
Yeah, and what would you say, Tina? Module grades?
Yes. No, I didn't put module grades. I had my overall accreditation on there. And just to add, if it's okay, a lot of you will think if I don't get a first, I am out of an opportunity, especially for industry. Please don't feel that way with your degrees. They need you to have a degree. And it's funny that your A levels seem really important. Then you get a degree and it's wiped away. And then you get your first role in industry. And then the degree, it's helpful to have and it's a tick box, but no one's going to drill into the detail. And I really hope that people still apply if they don't quite meet whatever accreditation or class level they think for their degree. You'd be surprised what you'd be able to get despite that. So.
I agree absolutely with you, Tina, with that one, in that sometimes we look at those person specifications and we look at all the expected and essential criteria, and we think, I can't meet all of the essential criteria. Well, if you meet most of the essential criteria, why not give that a shot? Because it's you, your individual application, that's going to be powerful. So one more question around, and this one might be for David to answer, around people who are making late applications for, is there a way to make late applications for placements? Is there still a chance for a year-long opportunity? Or what steps could they take to secure opportunities despite not thinking, oh, I might need a placement?
Yeah, thank you, Lorna. In a nutshell, we have to have that screening process done early in the year at level 5 for you to take interest in placement. If you're already at level 6, unfortunately, there is no opportunity for a year-long placement within the structure of the degree. We don't have what we call coterminous placements at the end of the degree. Once you graduate, you are effectively looking for employment within the diagnostic services and potentially migrate onto the IBMS portfolio for that route. We wouldn't be supporting you in that way. Recently, in the last week, I think on Friday, I sent out on the employability route, which goes to all students across the whole of the course, 2 application processes which are quite unique. One is at UKHSA, the Health Security Agency up in Colindale. It's a paid NHS trainee position for the year. It's very competitive and it's open to all students, irrespective of whether you have applied to do the placement or not. There was another role, and on the top of my head, I can't exactly remember what it was. I think it was non-clinical NHS roles. And again, that's been advertised as well. So if you haven't done placement and are at level 5, haven't done the expression of interest form at level 5 and want to consider those, have a look at those messages. They are on the Blackboard employability site. It's gone out by email. I know how many people have actually read the email because it tells me. And I would also say as well, while we're here, a bit of a gripe. It was quite surprising last week when we had that employability event that was advertised. Over 75 students applied to come along to the event. And I know from the registration only 27 people actually attended. So it's all very well ticking your name and saying, yes, I'll come and do these things, but you're going to get more out of it if you actually do attend and do this stuff. Okay, so there's lots of resources out there. Everything is available to you, the career service, the things we do within this type of thing within a module, but also extracurricular. But you've got to make the most of that. And by attending, you're going to get more out of it. Okay, so please do go and get those opportunities. As you know, everybody said today, things aren't just going to fall in your lap. You've got to go and do the work and the legwork. And if you don't do it, then you're not going to get anywhere. Okay, so the best you can do is attend these events. So thank you. That's my last bit of advice.
Alrighty. So one last question here, which is in bold on my sheet, and it says, when do you reckon we should start applying for these jobs? So what would you guys say? When should they start applying? Ina?
I was a bit keen. I was applying. I know I had my last exam on the 1st of April, if my memory serves me right. But I was already applying around February. Around that time, I was already applying, looking through what are available for me. It's just because it's not straight away. It usually takes a bit of time. I would say minimum 3 months before you can actually like get a proper interview. Just give yourself also that leeway time to like not stress yourself. So maybe start kind of early on, just looking around, checking the person's specification and like tailoring your CV and all that stuff. But I think really start a bit early on just to prepare yourself for that battle towards the end. Yeah.
Thank you, Ina and Joel. When should they start applying?
Do it around now, really. It's like what Ina was saying. I think now's a good idea. Be careful with doing too early, because if you do it too early, you might get a job offer while you're still studying, which is not the best idea. Do it around now, because the NHS, at least their recruitment processes take absolutely forever. You have the interview, you apply now, you get the interview, maybe April. By the time you start, it will be June, by which point you'd have finished your exams anyway, so that'll be perfect for you. So something like that is probably the best. But yeah, don't leave it last minute, because a lot of application processes can take a while. You're not going to get accepted and then start the week after. It could be a month or two. So keep that in mind.
Lovely. Thank you, Joel. And Tina, what would you say? When should they start applying?
Yeah, I'm agreeing with everyone. I think you can start now. I think preempting the stress you might feel when you finish your degree, it starts to feel like there's a bit more pressure. Make the start now. There's nothing wrong with that. at least for industry roles as well, it takes a while, and you can sit on job offers before you have to, get back to someone. If you do get through to that stage really quickly, it's not immediate. And a lot of places will allow you to say, look, I need to take the next 3 months to finish my studies, and then I can begin the job. If you're lucky enough to, go through the whole process and come to the other side of it, then that's great. But also, I think being able to focus on uni and having all the support, and maybe going through the first couple of rejections, if that does happen, I think it's undervalued how helpful it is having that support at your fingertips, so you can walk in and just knock on the door and speak to the employability advisors whilst they're still there, and get some feedback maybe on your CV. So go through the process a couple of times now, see what you get out of it, and take that opportunity to use the resources you have whilst they're still there. Would definitely be a wise decision, I think.
Thank you, Tino. Thank you to all three of you, because their advice is very clear. Start now. There you go. All right. So I would like to say huge thanks to our panel members who are alumni. They have given up their time for free today to come and share their experience with you. And that's a very precious thing that they've given to us. So if you can just put in the chat, thank you very much, to let them know how much you appreciate their time and the expertise that they've given and their unique advice. That would be marvelous. And thank you to the students who put questions here, all of the students who've attended, all of the questions, really useful. To those of you who are quiet, maybe didn't feel like they could ask a question, hopefully your questions have been answered through that process. And we would also like to remind you just to complete the feedback survey at the end, because it helps us to keep putting these events on if they are useful to you, and to know how to tweak them. The link will be posted in the chat, and there'll be a £20 Amazon voucher chance of winning that for you. So to our panelists, is there anything else you guys would like to say to this audience before we set them free? No?
I think I did say it on the chat, actually. Just good luck to everyone. I know everyone's about stressed out with their exams, with their thesis, with applying and all that stuff. It feels very overwhelming. Do prioritize what you need to do, like now, tomorrow. Don't, if this is something that you don't really need to do straight away, then yeah, just, it's good to know, but do focus on your thesis and in your exams. But yeah, there's a whole, don't be stressed, like feel like there's not enough posts or there's not enough jobs. There is enough jobs. There's enough opportunities. It's really up to you to get to them and make the most out of it. You make the opportunity. So yeah, I definitely believe that all of you guys are gonna make it, and good luck again.
Thank you, Inna. Wonderful. Thank you so much. Joel, do you want to say anything to these guys?
Yeah, everything Inna said, agree. Also, what I'd like to add is it always works out. It always will work out. So don't stress too much on that. It always works out.
That's lovely, Joel. That's nice for me too, because when we're pushing them along this plank, we can think, you know what, Joel said, it always works out. We'll keep pushing them along the plank. And Tino, anything else you want to say to these people before we set them free?
Yeah, I think I'm wishing you all the best for the rest of your studies. I know it's an incredibly stressful time, but like Inna said, your main goal is getting through the next week and then the next month and through these examinations. But you've got your entire life ahead of you, and there is so much time for things to go wrong and for things to go right. So I really hope that you're all kind to yourself and make sure that you believe in yourself for these interview processes. And I think the main advice I got was just face your front, focus on yourself. You've got friends going through their own version of stress and their own version of this process, but it's really important to think about what you want, and hopefully you guys take that forward, and I'm sure you'll do really well. So best of luck to all of you.
All right, lovely. Thank you very much. Thank you. David, have I left anything off?
No, I think that's fantastic. It's great
Wonderful.
to have you guys with us today. Thank you very much for your time and your input. It's been really much appreciated. I think the students have got some really good advice there. So hopefully that's really helped everybody. So thank you.
Yeah,
and thank you to Lorna for navigating the chairing of this session, and to
You're
the
welcome.
alumni team for making all this happen. Without them, it wouldn't happen.
Thank you. In the background here is our alumni team working really hard. Hayden and David particularly helping us all out there. So thank you so much. And yeah, thank you guys. And thank you for your precious time. Okay,
good to see you all. Thank you. Take care, everybody. Goodbye.
Bye.